Hi, everyone. This is Ghazi from DaTech, and we partner up with Johnson and Johnson this semester for BigCo, creating our product, which I will be going over in the slide deck and give a quick demo of our product. So to start off, our product is the ECG cardiac mapping model for surgical support and medical education. Our product narrative is to create a cardiac visualization tool that will assist cardiologists and surgeons by visualizing affected heart regions from ECG signals non-invasively to improve the speed and accuracy of diagnostics. And this is a really valuable tool because currently in the industry, doctors and cardiologists have to look through ECG graphs to diagnose what's wrong with patients. And honestly, they would have to look at hundreds of ECG graphs and waveforms to detect what the problems are. You can see from the background of this slide that the ECG graphs look really ugly. It's really hard to detect what the problems are, where the problems are arising from, so on and so forth. However, the doctors are well trained to look into these graphs, but still they would have to do a lot of mental mapping in order to understand where the problems are arising from inside the patient's heart. So this is where we come in pretty much. Our product is to design a solution where doctors would be able to just input the ECG waveform into the software, and the software would be able to identify what the problems are and visually show where the problems are arising from within the heart. Before they would they would have to just look into the ECG graphs and mentally connect where the problems are arising from. But with this software, they would be able to just look into the visual tool and just play with it and see where the problems are arising from within the heart. Additionally, currently in industry, if you are to look into localize the problems in the heart, they would also take some invasive way of approaching this problem as well. They would have to insert a catheter through artery and then go to target regions of the heart and collect data using electrode to pretty much have a higher resolution data to localize where the problems are coming from. However, with our product, of course, it's not going to be highly as well resolution as if you were to just use the electrode, but it will give a good understanding of where the problems are arising from. So how did we pretty much come to validation behind our product? Johnson & Johnson has the large medical portfolio across medical device portfolio across the industry. They are a leading expert when it comes to delivering doctors and patients the solution that they need. Within the Johnson & Johnson company, Biosense Webster, as a subsidiary company, they are pretty much the leading expert when it comes to cardiology and cardiac treatment. Their impact is largely across the US and outside of US as well. So pretty much they serve with patients with many cardiac problems, and they pretty much hold the industry standard for this type of problem. And additionally, we had a lot of medical professionals that we have talked to previously that pretty much gave us a good insight of what is needed in this medical space and in the problems that they face day to day. And their responses were really positive for our product, that they would use something like this to speed up their processes when it comes to diagnosing different problems and patient treatments. Additionally, we went on the field and we tried to get their actual hard number of results. So what we did pretty much was we sent different medical practitioners, experts, to answer few questions regarding regarding diagnosing cardiac problems. You can see on the left side that we had a 12-lead ECG data without any visual tool or anything like that. And on the right side, you could see that there is a ECG, 12-lead ECG data sets and a visual tool around there to help them diagnose. And based on the results that we have seen, the doctors, nurses, and also other medical students, they were able to answer the question with visualization tool about the half the time they would take without the visualization tool. So we had two questions that we made them answer, and for both questions, they took about half the time with visualization. So this gave us a really strong indication that something like this would be really helpful for surgeons, doctors, nurses, and other medical specialists. So our progress timeline for this product was really fast paced. We had to accomplish all of this within 3 months of our products. With our BigCo studio timeline. So for 2 weeks, we just went through the ideation, what type of problem we should tackle, and then for the next 2 weeks, then we conducted an interview with medical practitioners, doctors, and to see what are some of the problems that they face. And then the next 2 weeks after that, we conducted rigorous experiments regarding what is viable for this problem space. And then after that, we created a lo-fi demo, and then also did some refinement and conducted more experiments. And then after that, we worked on our hi-fi prototype to pretty much see how far we could go and have an MVP product by the end of the semester. And this is where we are at this point. Of course, we want to progress as time goes along. And thank you so much for the support. And yeah, so next, I'll just go over the technology behind this product. So pretty much how it works is the user, whether if it's doctors, nurses, or medical students, they would upload ECG data into our, currently we have a web app. And in that web app, we have an machine learning model embedded within the app. And what the app would pretty much do is pretty much read the ECG data. It'll process the ECG data, and it'll pretty much identify the problems, where the problems are arising from, and then output it into a visual format where the doctors and other medical experts would be able to interact with it. So pretty much that's the gist of our technology that we have currently. And I'll give the hi-fi demo, and I would like to, of course, thank our mentors and experts that we have interacted with throughout the semester to give us valuable insights. And now I'll just quickly go over the hi-fi demo with you. Okay, so this is pretty much our web app that I mentioned earlier. We have about hundreds of patients of data. And the machine learning model that we have here is looking into different arrhythmias. We had this model from a Nature article that we'll be happy to share. And honestly, that since we didn't have a lot of time, we wanted to have something for our Maker Day, to have the MVP product. This was a great way to start because the model was pretty much well established. The model was validated by a lot of cardiologists, senior cardiologists, and also there were a lot of rigorous experiments behind this model. So we pretty much took that model and we had the data sets from there, and we pretty much fed into our system. And from here, we also have different formats. You can see on the left side that we have different filters. We can pick and choose which type of conditions that we want to look into. So now you can see that all the conditions are checked on. So pretty much it will show all the patients with given conditions that we have selected. So let's say, for example, if we want to look into first degree AV block, we can unselect all these conditions, and now we have a patient with that has a first degree AV block. So let me see if there are other patients. Yep, there are other patients that have the same problems, and some of the patients also have two problems or multiple problems at the same time. You can see that there are different colors according to this. So I'll just pick patient 67. So we color coded the risk associated with the diagnostics here. So pretty much if we have a color blue, it's associated as a low risk, yellow as a medium risk, and red as the high risk. The reason why we selected as a color code like this is because there are a lot of variabilities within the ECG data sets. Now, the model is able to diagnose the problems, and usually the model runs on a probabilistic space, which gives us outputs as from 0 to 1. So what we did was we pretty much separated this out as different thresholds. So let's say, for example, 0 to 30 would be low risk, 10 to 30 would be low risk, 30 to 60 would be medium risk, and 60 and up would be high risk. We could also the doctors would be also able to see the detail if they want to see how the model is running in detail. They could press on the detail option, and then they could see the probabilities that it has been outputted from here based on the ECG data that was fed into this product. So yeah, so this is what we have so far. Of course, this is not ready to be worked in a clinical space yet. It would take rigorous experiments, lots of clinical trials, and also preclinical, clinical trials, FDA approval, and so on and so forth. However, we do want to use this kind of product as a tool for medical students, because we have seen a lot of medical students struggle with the electrophysiology behind cardiac health, and they were really intimidated by answering these type of questions. So if we can provide something like a tool like this, where they would be able to just look into the ECG graph on this side, on the left side, and map it to the right side, where you could visually see where the problems are arising from, and which the nodes and which electrodes of the ECG is giving that type of data. They could easily map into that, which will add a lot of value into their education and their learning experience. So pretty much we would be more inclined to first push it to the educational side of things, while simultaneously working for the clinical aspect of this product, where the surgeons and cardiologists would be able to use that product. So yeah, this is pretty much our product. I hope you enjoyed. Looking forward to talking to you guys more about it.